Gracias. Many thanks, and a very good morning to you from a beautiful New York City, where we're enjoying some decent weather as we get started. We have barely 20 minutes. I'm jumping straight into the discussion of revitalizing resilience and investing in health for growth. Our guests to my left, it's David Rubenstein, the co-founder and co-chair of the Carlyle Group. And with me, of course, as well, is Todd Gibbons, the CEO of BNY Mellon here in the US. We've got 20 minutes. It's barely time to get to grips. So I need your best point in terms of investing in health. Start with you, David, bearing in mind the pandemic that we're coming out of.
The pandemic showed everybody how important health is. We obviously knew it was important, but we realized how vulnerable we still are. Despite all the modern conveniences we have in the West, we still are very vulnerable to a pandemic and other kind of health problems. So it's no doubt that if we invest in the money that we have available, we can prevent these kind of pandemics in the future. But more significantly, what we've learned is that if you're going to have a vibrant economy, you need to have a healthy population. And if you have a healthy population, your economy is going to be much, much better.
Todd?
Well, a great point. I would add to that if you look at what the drivers of health is and how clearly, I won't even make the argument. Clearly, GDP is impacted by health, and I think all the data supports that. But even setting the pandemic aside, I'm a big fan of David Sinclair. He's a professor at Harvard University. And when he talks about health, he talks about 80% of it is what we do to ourselves, and 20% of it is genetic. And when you think about what we do to ourselves, and he's got great, and I'm probably doing him a disservice here, but he's got great data that supports this. There are really four things that matter. One is diet, exercise, getting enough sleep, and avoiding stress. We in the financial services industry can do something about number four, avoiding stress, which probably impacts sleep as well, it might add, at least for me personally. So I think that's where we can actually really target.
Okay, well,
about getting enough sleep, I don't know if I like that one so much, because Jeff Bezos once told me in an interview he needs to get 8 hours every night. So I thought, geez, what am I doing wrong if I'm not getting 8 hours a night? Look what he's done. But it's no doubt that people should get closer to 8 hours a night and be more productive.
So the investment community, taking in mind what Todd was just saying, are the two that we can look at, if you like, stress and the diet, exercise, and I forgot, sleep. But where does the investment community focus its attention on?
The investment community has three responsibilities. One, make certain that its own employees are healthy. Second, make sure their customers are doing things that will keep them healthy. And third, make sure the population that it really serves in the community or the country it serves is also healthy. If you have healthy customers and you have a healthy population, your business will be more productive.
But you're saying that it's not that straightforward.
Well, I'm saying that the number one driver of stress is financial uncertainty. So I think that's one of the issues the financial services business, and certainly as an employer. I mean, I think David hit the point. What we can do, and we've learned a lot through COVID, what we can do to relieve stress for our population, for our employee population, and even our communities nearby. I mean, I've been a big proponent, for example, of financial literacy. In the United States, we do not have, our young people are not coming into the workforce with any financial literacy, any ability to handle their own their own household finances. We don't teach them about credit. We don't teach them about debt. We don't teach them about how insurance and how credit card works. And you are 3 times more likely to be depressed if you're indebted. And so I think there are things that we can progress here.
Well, what COVID taught us more than anything else is that the world is a tale of two cities. If you are in a Western country like the United States, you're probably going to get a vaccine. You're probably going to have reasonable health. But if you're in an emerging market, you're probably not going to get the vaccine so readily, and you have a lot of health problems. And so to the extent we can do anything to improve productivity in the world, we've got to do more in the emerging markets.
Right, but the investment, I guess the investment money goes into where the profits are greatest. And that means the US healthcare system. It means public-private partnerships in the United Kingdom. It means the pharmaceutical industry, for example, in Europe.
Well, clearly those are very profitable areas, But there are enormous opportunities in the emerging markets where major healthcare companies and major companies can do investments to improve the health of people there. So if the population of Africa, for example, is healthier, they're going to be better customers for products that are made by American companies.
But that's a very long term.
Well,
that's a very long term strategy for an industry that traditionally would think in relatively short term returns.
Yeah, but the world has recognized you can't just focus on quarterly earnings anymore. You have to focus on longer term earnings if you're going to have a sustainable company that's going to be around for the longer term, which is much better for the world.
Do you think that's true? Do you think that we have got away from the quarterly mentality?
No, I think we're still tied into a quarterly mentality. But I do think for the first time we're starting to talk much more in much more detail around sustainability. And what we've done, and COVID's a very interesting driver of this, because what we did before COVID, we talked about sustainability as infrastructure, as and around operations and things like that. But now when we talk about sustainability, we're talking about actually the resilience of our own employee base for the first time.
Now, right now, we measure companies by earnings and by PE ratios and so forth. At some point, 10 years from now or maybe sooner, each company will have an identification number that would indicate their sustainability factor, and will have some kind of indicator that will rate people not just on their quarterly profits, but on more important things like sustainability and what they're doing for the world's health.
So I was looking at rebalancing my 401k plan here in the United States, which is the pension system that's a defined contribution system that'll mean I'll be poor until well into my old age. But as I'm going through the prospectuses of the various funds, there is the ESG and there's the green to red. I didn't look at them. I'm only concerned with annual return. I'm only concerned. At what point will I become more interested in the ESG?
Well, the 401k investor is not the only things you have to worry about. We have other considerations as well. But at some point, you will look at this, because you'll realize that if you invest in companies that are only worried about short-term quarterly profits, 1 year, 2 years, 5 years from now, your profits aren't going to be as great in your 401k.
Todd, the way we are moving forward in a post-pandemic world, and I say post-pandemic somewhat advisedly because I'm well aware that many of our viewers are living in countries where the vaccination rates are tiny compared to here in the United States. How worried are you about mental health?
Well, can I go back to
my 401k?
Back to your 401k and your investment decisions in ESG. We are seeing ESG, first of all, it's really grounded in Europe. So we're seeing huge amount of institutional, and even now we're starting to see it on the retail side, flows into ESG product. The U.S., that's happening now more quickly than you might think. Right now, the quality of the data that we've got is not that great, but we've got a particular app that crowdsources the quality of data and constantly tries to improve it. I think you're going to see GAP, applied to sustainability discussions with the same rigor around those. Right now, it's very hard to tell whether there's greenwashing or anything else. This will eventually become a very, very prominent part, even down to the retail investor, and sustainability will be a key component of that. So,
younger investors than you and me are focused on ESG.
Really?
So you're not yet probably as attuned to the things that younger investors are focused on, but increasingly younger investors care more about sustainability and ESG than people your age and my age, and I'm older than you.
The focus on that, at Carlyle, what do you look at?
Well, we have an ESG team, and every time we look at buying a company, we have our ESG team do all the kind of metrics to see whether this is something that we can put our name behind, and also can we improve the ESG performance. So we don't ever go into a company now not looking at what they're already doing in ESG and what we can do to improve ESG. And that's fairly standard in our industry.
And well, can we just say, when you look at health investments in this post-pandemic or this pandemic, endemic, whatever word we use, what are you looking at now in those?
Well, we're obviously looking at how they suffered through the pandemic, but are they going to be able to sustain their profitability in a post-pandemic world? The world's changing, and people are going to function differently. And so how are all healthcare companies going to function post-pandemic? That's what everybody's looking at.
Extrapolating from that, one of the things that we've learned from COVID, and I think it will be permanent, is some of the things that we have to do to reduce stress and the mental health issues that we'll have in our workforce. Some of the things that we've done is, we built some digital apps, some virtual assessment, We got 24/7 consulting. Consulting that is available to you confidentially. And I think we're going to have more innovation around daycare as well. So I had two of my children, my daughter and her husband and their two children living with us during part of the pandemic, and I can only tell you the number of balls that they were juggling to make things working from home and taking care of children. We've got to improve that. Let me add one more thing here. I think actually the future of the workplace is going to change a little bit, and I think that the stress of commuting, the cost of commuting in a hybrid environment will be more attractive to people as well.
Well, the industrial revolution that really started in your country took about 100 years before it changed the way we live and work. Now, COVID is changing the way we live and work in just about a year and a half. It's amazing how quickly that change is occurring.
So how many employees do you have?
50,000.
So when you're talking about policies for 50,000, whether it's working from home, mental health abilities, are you aware of the titanic shifts that have taken place in the last year, in the sense of, but at the same time, you've got to continue the business of banking, and that makes profits.
Yes. No, I'm very proud of the fact that just how resilient our workforce was over a 2-week period. We had 45,000 people move from an office environment to a work from home environment, and we didn't miss a beat. We're the largest custodian in the world, and we were able to meet our clients' requirements, and it just demonstrated the resilience of our workforce. But we now need to bring it up a step. We need to bring it up a level.
That's a very important point. The people who are in the banking world, financial services, private equity, we did reasonably well during this pandemic. The people who work with their hands very often don't have the education many of our employees do. They suffered a lot. And one of the big problems we have to deal with is post-pandemic is how to pick up the people that have really fallen in the crater post-COVID and how they're going to really get back to where they were before.
That is the issue. That is the social welfare issue, whether it's social care in the United Kingdom, where the government's come up with new plans, or the Biden infrastructure and the social care plan that's being put forward. We are looking at higher taxes for the wealthy in every developed country. Do you both agree?
We are looking for them.
I think that people in Washington are looking at having higher taxes, try to get that through Congress. Whether that will get done or not, I don't know.
The terms of the public-private relationship in the provision of health care, there's a huge difference now between the US and the rest of the world, where costs have gone through the roof. It is a predominantly, even though Medicare is by far the largest single payer as such, but collectively the insurance companies are still predominant.
Well, in the United States, we have a different system than UK. Yeah. UK is probably more government-oriented than we are. We have, I think, the best healthcare in the world, but it may not be because of the system. But I do think we're going to a system where more and more of the government will be involved in our healthcare system.
I don't have anything to add.
Right. Then let's move to one thing that yesterday, the US government announced it was lifting the restriction on foreigners coming into the United States, provided they are fully vaccinated, 2 vaccinations or single vaccination if it's Johnson. This is going to exacerbate the inequity within vaccination, where most of the world is barely vaccinated.
That's true. And a lot of people in the United States are not vaccinated. We have a real political and other social issue in the United States where some people don't want to be vaccinated. And if we don't get to about 80%, we're never going to get to herd immunity. That's a big challenge we have in this country.
But even if you do get to herd immunity, it's still not going to be the answer. I mean, Israel has shown herd immunity. The UK has shown herd immunity.
It's not a perfect thing, but you're better to be vaccinated than not vaccinated. And we still have a problem that we take pride in getting the vaccines developed in less than a year, but we don't actually force people to get the vaccines.
But Todd, I'm worried that the gap between the developed and the developing world is is greater as a result of COVID. And I don't say we are sailing blithely on, because there's a lot of good words being spoken, even here in New York during the UN.
But the gap is also getting greater in the United States and other wealthy countries between those, the bottom of the sector in the United States or in UK, and the wealthier.
But that bottom is higher than the rest of the world to start with. It's, I suppose, my point. Todd, I just wanted to get your view on, though, this idea of the difference between, or the inequality that's growing in the world at the moment.
There's no question that it's continuing. The pandemic has exacerbated. I mean, we're even talking about healthcare. I mean, clean water in most parts of the world would go a long way to improving health. I mean, you see some of the work that Gates is doing, where he's really focused on things that you get the most direct benefit for. So there's no question that that gap is growing. Where the assets and wealth is accumulating is still in the developed world. We're seeing some of it in the developing world, but not nearly at the pace. In fact, when we talk about retirement,
Yes.
you're going to have 600 million retirees coming out of China and India in the not too distant future, and there are simply nowhere near the kind of savings that they need to have in place to support what they're going to face. That's going to be another angst over overarching. It's another mental health issue.
And if that is the case, what do we do? I mean, when I say that, I'm not suggesting you come up with a plan and say, here's 15 points, but I am suggesting that we are facing the biggest crisis in terms of retirement that we don't even understand the depths of yet.
Well, retirement ages are increasing in the United States because people don't feel they can retire at the age that they used to retire at, in your country as well. But the most important point you've made, I think, is this. The concept of equality is a concept that really began in the United States to some extent. There's never been a concept around the world for most of organized history that everybody had to be treated equal. It really came from the United States, and now we're trying to make sure everybody around the world is treated equally. It's not the case, but the concept of equality is a very important concept because 300 years ago, it wasn't thought that everybody should be treated equal.
Well, yeah, but it's a concept you'd agree with.
Yeah, of course. The United States really invented this in the Declaration of Independence, but now everybody around the world is kind of focusing on how we get there, but it's not that easy to get there.
Right, but don't we have a duty to do our best to get there? Both of you. You first, sir.
Yes, absolutely. And I think there are plenty of problems in the U.S. that were reflected, not just relative to COVID, but the other racial issues and tensions that we've seen. Inequity and inequality leads to inequity, and I think that really got highlighted. And actually, and we're starting to see actions, and part of even our ESG reports. You're starting to see this come out. Some of the reporting that you're going to see from institutions like ours is going to be very specific about things that we're trying to do to make things a little more equal.
I think the vaccines are now getting disseminated in the poor countries in the world, but not as good as it should be, and there's a big challenge. The Western world developed these vaccines, but we haven't disseminated them as rapidly as we should in the emerging markets.
And where is our duty? The FII, the G7, they couldn't even get $1 billion, by the way, at the G7. They couldn't even get donations of 1 billion doses at the G7 in the summer. So where is our wealthy, privileged responsibility?
Well, we have a responsibility to help people, I think, in our own country and then in other countries as well, to get to the point where everybody is able to lead a life where they can live up to their potential and also have a healthy life. Because, if you don't have a healthy life, everything else doesn't matter. And in many parts of the world, people don't live to the 80-year-old average age we have in the United States and the Kingdom, and United Kingdom because of healthcare, lack of healthcare treatment.
But I guess what I'm trying to say, or what I understand, is we're failing, Todd. We've succeeded in getting our house in order on the vaccine in the US. And yes, you're right, there are people in the developed world who don't want it for whatever perverse reasons or legitimate reasons, either way. But we are failing the developing world.
And, I kind of go back to my first point. If you think about health, it's really around education. It's really around being, of course, it's having resources available here. We're kind of thinking after the problems evolve, but the preventative medicine is going to be is by far the most effective. And what we're learning in the data that we've got now, and how we disseminate around the world to lead to better outcomes, I think there's a lot of opportunity for us here.
Well, we're doing a better job than we did 100 years ago or 200 years ago. Then the developed world didn't really care about the developing world. Now we care about it, but we haven't done as much as we should. So I think expectations are much higher what we should do than they have been historically been. That's good, but we have a lot of work to do, but we are making progress.
Right. If we finish on this thought from each of you, bearing in mind the institutions that you lead, and how will you direct the policies of those institutions in the next 12 months towards the goal of better health?
Well, all institutions are going to make certain that their employees come back and they are healthy and they're mentally healthy and basically in a position to do the job they're supposed to do. That's the highest priority of a lot of companies. Make sure their employees come back and they're in a healthy position to work again.
Absolutely. The number one thing we're going to do is make sure that the programs that we provided our employees, that assisted them with any mental health issues, the safety of the environment in which they're going to operate, those are going to be at a level that we've never seen before. That's the number one thing that we can do as an organization. And more broadly, as we provide education around financial literacy, saving for retirement, taking some of the stress away.
Richard, for your 401k, put everything in private equity. You'll be okay.
Are you offering to take it?
I don't know what we can take.
Yeah, there you are, you see. He tantalizes. And then
there are a lot of good private equity firms, but...
I'll take that as a yes and maybe and talk about it later.
All right.
Thank you very much, gentlemen. I appreciate it. Thank you very much indeed.
Thank you, Richard.
As we now move forward, it is now my pleasure to welcome to the stage Professor Jose Manuel Barroso. He's the board chair of Gavi. He was also, of course, the European Commission president during some very difficult times. Now as Gavi, the Vaccine Alliance, he is very well versed in the issues facing what's happening today with the pandemic.